Bismillahirrahmanirrahim. Assalamu alaikum. Viewers, I am Dr.M.Saleem Iqbal, Assistant Professor of Surgery, Deputy Controller Examination, Faisalabad Medical University, Faisalabad, Certified in Medical Teaching from University of Health Sciences, Lahore, Research and Clinical Coordinator to Vice Chancellor, Faisalabad Medical University, Faisalabad, and Spokesman, Faisalabad Medical University, Faisalabad. Today, I am here with another important topic. But before I start today's topic, I request you to subscribe my channel and press bell icon. Today's topic is Viva Made Easy Part 2. What to see on X-rays in diabetic foot. Condition of bone, that is osteomyelitis or deformity, foreign body, gas shadows for gas gangrene. What is pathological difference between lobular and ductal carcinoma breast? Ductal carcinoma has high nuclear grade, anaplastic cytology, and formation of ducts-like structures, while lobular carcinoma has minimal cellular atypia, Indian file pattern of infiltration, and absence of glands or ducts formation. What is a closed versus an open hemorrhoidectomy? Closed, also called Ferguson's technique, closes the mucosa with sutures after hemorrhoid tissue is removed, while in open, that is Milligan-Morgan technique, mucosa is left open after removing hemorrhoidal tissue. What is a ceton? Thick suture placed through fistula tract to allow slow transaction of sphincter muscles. Scar tissue form will hold the sphincter muscles in place and allow for continence after transaction. What measures provide protection from wound infections? Shower the night before surgery with chlorhexidine scrub. Never use a razor for hair removal. Electric shavers only. Ensure adequate skin preparation in operation room. Do not close skin in contaminated cases. Ensure preoperative antibiotics in bloodstream before incision. Ensure no necrotic tissue. What is the 100, 50 and 20 rules? Maintenance IV fluids for a 24-hour period will be according to the following formula: 100 ml per kilogram of body weight for first 10 kilograms, 50 ml per kilogram for next 10 kilogram of weight, and 20 ml per kilogram for every kilogram over 20 divided by 24 for hourly rate. What is Mendelssohn's syndrome? Chemical pneumonitis after aspiration of gastric contents is called as Mendelssohn's syndrome. This occurs when patient is not properly nil per oral before surgery. Standard protocol of nil per oral should be followed before proceeding to major surgery to prevent this complication. If fine needle aspiration cytology of cervical lymph node revealed metastatic adenocarcinoma, how will you proceed? The primary sites like thyroid, salivary glands, lungs, and gastrointestinal tract should be investigated to find out any site of carcinoma in these organs. Treatment of primary lesion is done if it is found. A radical neck dissection is done in thyroid and salivary gland carcinomas. If the FNAC of cervical lymph nodes shows that it is metastatic squamous cell carcinoma, what will you do? A thorough clinical examination of possible primary sites in scalp, face, mouth, cheeks, lips, nasopharynx, and larynx to detect any primary lesion. Is it possible to differentiate follicular adenoma and follicular carcinoma in fine needle aspiration cytology? No. The fine needle aspiration cytology picture of follicular adenoma and follicular carcinoma may be the same. The diagnosis of follicular carcinoma is dependent on finding of capsular and vascular invasion by the neoplastic follicular cells. This cannot be commented from the fine needle aspiration cytology. How do you determine how much of nasogastric tube should be advanced into the body for correct position. A rough guide is from nose, then around ear to 5 cm below xiphoid. What is a surgeon's knot? Double wrap throw followed by a single square knot throw will be surgeon knot. How will you identify facial nerve during surgery? There are some anatomical landmarks which lead to identification of nerve during surgery. The nerve lies at the junction of cartilaginous and bony part of external auditory canal. There is a palpable groove between bony external auditory meatus and mastoid process which is filled with fibrofatty tissue. The facial nerve lies deep in this groove. The posterior belly of digastric muscle is inserted into mastoid process just behind the stylomastoid foramen. By the dissection of medial border of posterior belly of digastric near its insertion, facial nerve may be identified. Styloid process itself can be palpated superficial to stylomastoid foramen, and nerve is identified just lateral to the styloid process. Nerve can also be identified during surgery by the use of nerve monitor. Why stone formation is more common in submandibular duct? The secretions of submandibular gland is more mucus and viscid. Submandibular duct has long curved course. The duct opens in the floor of mouth at a little higher level than the level of submandibular gland itself. Because of this upward course, there may be stasis of saliva in the submandibular duct, resulting in precipitation of calcium salts. What are the problems in patients with cleft palate? These patients have difficulty in suction, defective hearing, defective speech, defective dentition. Repeated respiratory tract infections may occur in such patients, and cosmetic defects. What are the indications of thoracotomy in traumatic hemothorax? Massive bleeding, more than 1.5 liter of blood drains on the insertion of chest tube. Brisk bleeding, bleeding more than 100 ml every 15 minutes for 1 hour. Continuous bleeding, bleeding more than 200 ml per hour for consecutive 3 hours. Associated major airway injuries requiring thoracotomy. Suspected esophageal injury. A posterolateral thoracotomy is done. The bleeding vessel is identified and secured by ligation. Chest is closed by placing an intercostal tube drain. How will you differentiate a neurogenic and vascular claudication? In vascular claudication, patient usually has pain after walking for some distance, and pain gets relieved by simply taking rest. In neurogenic claudication, patient usually has pain after walking for some distance, often after taking few steps. Patient gets relief after taking rest and on assuming some posture so as to relieve compression of nerve, and all the peripheral pulses are palpable. Why rest pain is worst at night? Rest pain often awakens the patient from sleep. During sleep, there is diminution of heart rate and blood pressure may also drop. This may result in further hypoperfusion and may aggravate ischemic pain. How will you treat varicose veins secondary to deep venous thrombosis? In post-deep venous thrombosis varicose vein, the superficial veins are the only channels for return of lower limb blood to heart. Stripping and ligation of varicose vein in this situation is absolutely contraindicated. The conservative treatment for varicose vein is required in this situation. Rest with foot and elevated and the use of elastic stockings. After HEMI-THYROIDECTOMY, report has revealed it to be a follicular carcinoma. Now what will you do? Completion thyroidectomy is done preferably on the next available elective list to facilitate subsequent management with the whole body radioiodine scanning and follow up with thyroglobulin study. How will you maintain continuity following resection for Whipple's operation. Pancreaticojejunostomy and to side, hepaticodocojejunostomy and to side 10 to 15 cm beyond pancreaticojejunostomy and beyond 10 to 15 cm of hepaticodocojejunostomy do gastrojejunostomy. What do you mean by periampullary carcinoma? This includes a group of malignant tumor arising at or near the ampulla. Adenocarcinoma from head of pancreas adjacent to ampulla within 2 cm and it occurs in 40 to 60% of cases. Ampullary tumor arising from ampulla of ureter 20 to 40% of cases. Then distal bile duct carcinoma in 10% and duodenal carcinoma adjacent to ampulla in about 10% of patients. What are the advantages and disadvantages of MRCP for evaluation of bile duct? MRCP is newer modality of investigation and it provides virtual reconstruction of whole of the biliary tree from slices of MRI of hepatobiliary tree and can give very good picture of entire biliary tree. It is a non-invasive investigation, no radiation exposure and no dye is required. The biliary tract dilatation, any obstruction due to stone or growth may be ascertained. The limitation of MRCP is that it is only of diagnostic value as no intervention is possible. What are the advantages and disadvantages of ERCP? The advantages of ERCP is that it can be used as diagnostic as well as therapeutic. Therapeutic intervention like sphincterotomy and stone extraction or biliary stenting is possible. Bile aspirated may be used for exfoliative cytology, biopsy from periampullary lesion or brush cytology from bile duct may be taken. This is an invasive investigation, requires introduction of gastroduodenoscope, cannulation of bile and pancreatic ducts, and injection of dye. There is a chance of post-procedure cholangitis or pancreatitis, which may be life-threatening. What is BIRADS category for breast imaging reporting? BIRADS category and definitions. Grade 1, incomplete assessment and needs additional imaging. BIRAD category 2, negative, nothing to comment on. 3, benign findings. BIRAD category 4, probably benign finding and follow-up study is suggested. And BIRAD category 5, suspicious abnormality, consider biopsy of the lesion. What are the advantages of sentinel lymph node biopsy? Minimally invasive technique which can reduce morbidity and cost by identifying 1 or 2 lymph nodes most likely to be involved. More detailed histologic analysis is possible. Micrometastasis may be detected, may obviate the need for axillary lymph node dissection in breast cancer patient without compromising staging information, local control, or long-term survival. What is QUAT? QUAT is quadrantectomy, axillary dissection, and post-operative radiotherapy. What is the implication of lymph node involvement and different levels in carcinoma breast? Level 3 or apical lymph node involvement indicates worst prognosis. How will you manage major flail chest? Patient should be treated in an intensive care unit. Patient needs intermittent positive pressure ventilation for about 2 to 3 weeks. Flail segments get stabilized in 2 to 3 week time. Then general care, intermittent suction, care of skin, antibiotics, bowel and bladder care, and maintenance of nutrition. Routine fixation of flail segment is not required. However, if there is any underlying injury requiring thoracotomy, flail segment can be fixed simultaneously. What is stroke in chest? Fracture of multiple ribs at one point may cause indentation of a segment of chest wall without showing any paradoxical movement. This is called as stroke in chest. What is Kaiwura? It is for spinal cord injury without radiographic abnormalities. Children and young adults are susceptible to scivora due to tearing or contusion of spinal cord from overstretching, and spinal column subluxation due to ligamentous laxity and flexibility of developing spine. This occurs before any obvious soft tissue injury or fracture is observed in vertebral column. Scivora occurs in 15 to 25% of all pediatric cervical spine injuries. C2 is the most common level injured, and most common age group is less than 3 years. Pediatric patients with scivora may present with brief episodes of upper extremity weakness or paresthesias, followed by delayed development of neurological deficit that appears hours to days later on. What is pathophysiology of PUD orange appearance? PUD orange is derived from French translation orange skin. When lymph drainage in the breast is compromised by a tumor, it can result in edema expanding the interfollicular dermis and producing characteristic dimples which resemble the texture and appearance of orange peels. When deeper subcutaneous layers are involved, it can also cause pitting. This finding is most commonly seen in inflammatory carcinoma of breast. A full thickness punch biopsy of dermis is essential for definitive diagnosis. In general terms, how much small bowel is required for relatively normal function and avoidance of short gut syndrome and reliance on parenteral nutrition. 100 cm in the absence of colon and 50 to 60 cm if the colon is present. Why male breast cancer presents as advanced malignancies? There is only small amount of soft tissue in male breast, and therefore the carcinoma will infiltrate the skin and nipple early. Early involvement of pectoral fascia and muscle is because of the above reason. And then the lack of awareness of male breast cancer. How many lymph nodes are there in the neck? Roughly 300 nodes out of total 800 nodes in the human body, and about 150 lymph nodes are in the mesentery. What are pathological stages of tuberculosis of lymph nodes? There are 5 stages. Stage 1, lymph nodes are enlarged and firm. Stage 2 of periadenitis, lymph nodes are large, firm and matted together, that is fixed to each other because of periadenitis. Then stage 3 is the stage of caseation and cold abscess formation. In stage 4, there is a collar stud abscess. The deep cervical fascia is eroded eventually, resulting in escape of pus beneath the superficial fascia. And stage 5 is the stage of sinus and ulcer. The pus will eventually burst through the skin, resulting in discharging sinus or ulcer. What is a collar stud abscess? The pus is formed as a result of breakdown of lymph nodes, which will subsequently erode the deep fascia and comes to space beneath the superficial fascia. There is a superficial soft swelling which is nothing but pus and is communicating with offending lymph nodes situated deep to deep fascia. The node, the connection and superficial soft tissue swelling together will take the shape of a collar stud. What is the primary focus for cervical lymph node tuberculosis? The tonsil is usually the primary focus for cervical node tuberculosis. This can lead to jugulodigastric node enlargement, tonsillar group of lymph nodes, and from there it will reach to other groups in the neck. What is Delphic lymph node? The Delphic lymph node is the first lymph node involved in carcinoma of thyroid. It is nothing but enlarged prelaryngeal lymph node. What is the importance of examining the scalp in carcinoma thyroid? The main mode of spread of follicular carcinoma is by bloodstream. The commonest metastasis in the bony metastasis, which is usually seen in skull bone as a pulsatile bony swelling. What are types of obstruction without air fluid levels? Meconium ileus, pseudo-obstruction, and duodenal obstruction. What are criteria for labeling a cyst benign? It should be aspirated completely under ultrasound guidance. It should not refill. It should not contain hemorrhagic fluid, and it should not contain malignant cells on cytology. What is divergent colitis? It occurs after ileostomy. Short chain fatty acids acetate, butyrate, propionates are produced by bacterial fermentation of dietary carbohydrates. These short chain fatty acids are a source of energy for colonic mucosa. Loss of fatty acids lead to colonic atrophy and called divergent colitis. What are absolute advantages of laparoscopic hernioplasty? Bilateral hernia and recurrent hernia. Define rest pain. Severe intractable pain that keeps the patient awake all the time, not relieved by any medication, and due to severe vascular disease is called as rest pain. Where sentinel lymph node biopsy is recommended? In carcinoma of breast, in carcinoma of penis, and in malignant melanoma. What is generic approach to X-ray film interpretation? Always remember rule of 4 Ds. Number 1, detection. Number 2, description. Number 2, description. Number 3, differential diagnosis. And number 4, decision of management. What are types of ileostomy reversal? These are intraperitoneal reversal and extraperitoneal reversal. In intraperitoneal reversal, the window between two loops is mobilized and anastomosed. In extraperitoneal, window is not mobilized, just margins freshened and put back. Extraperitoneal closure is less commonly used nowadays, and it has disadvantages of patient feel gurgling sounds, and there is more risk of subacute intestinal obstruction. How you will define sterile metastasis? It refers to metastasis under treatment that contains no viable tumor. Nodule typically consists of necrotic or fibrous tissues. What is minimal invasive surgery? Minimal invasive surgery is defined as achieving therapeutic goals with minimal somatic and psychological trauma to body. It is the procedure that is carried out by entering the body with smallest possible damage to the structure. What are advantages and disadvantages of onlay, inlay and sublay meshes? Onlay mesh anterior to rectus sheath. Advantages: easy to apply, less time consuming, and disadvantage is that patient has discomfort and there are more chances of seroma formation. Sublay mesh repair. Mesh is placed behind anterior rectus sheath or anterior to posterior rectus sheath. Advantage is that it is an ideal method. Disadvantage: meticulous dissection, more time consuming, and more chances of hematoma formation. And once it is infected, it is very difficult to remove. Then inlay repair. It is directly bridging over the defect. Advantages are achieve tension-free repair in larger defects, and disadvantage is the risk of adherence obstruction. What is desmoid tumor? Fibrosarcoma of aponeurotic sheath usually occur in scar tissue. It is locally malignant and wide excision is the treatment. If it is recurrent, do wide excision followed by radiotherapy. Differences between Pylades tumor and fibroadenoma. Following are differentiating points of Pylade tumors. Rapid growth, size more than 3 cm, fibroadenoma-like mass in women older than 35 years of age, then round border or lobulated appearance, cystic areas with solid masses on ultrasonogram, hypercellular stromal fragments of fine needle aspiration cytologies, and intermediate factors in fine needle aspiration cytologies and true cut biopsies. What is the significance of abdominal pain after eating fatty foods? It suggests biliary origin of pain. Fatty food ingestion triggers the release of cholecystokinin, which leads to contraction of gallbladder. Gallstones may obstruct cystic duct so that gallbladder is unable to empty bile as it attempts to contract after fatty food ingestion. The ensuing distension of gallbladder stretches the visceral peritoneum that surrounds it, leading to right upper quadrant and or epigastric pain that is vague and mild to moderate in severity, that is symptomatic cholelithiasis. What is the significance of right upper quadrant pain combined with scapular pain? The gallbladder and the scapula share same cutaneous dermatome from same spinal cord levels. The scapula receives cutaneous innervation from supraclavicular nerve. Since the same spinothalamic pathway, pain and temperatures are activated. Gallbladder distension or inflammation triggers the scapular pain via phrenic nerve. What is the difference between PET scan and CT scan? PET scan is a physiological scan while CT scan is an anatomical scan. What are conservative amputations? Ray amputations and transmetatarsal amputation is also called conservative amputation. What are pre-medications? These are medications given before the induction of anesthesia and includes anxiolytics and antihypertensives. How blood-testis barrier is formed? It is formed by tight junction of Sertoli cells that protects developing spermatocytes from toxins. What are causes of giant metastasis in lungs, canal balls, canneries? These are head and neck carcinoma, testicular and ovarian carcinoma, soft tissue carcinoma, breast carcinoma, renal carcinoma, and colon carcinoma. How to measure size of pneumothorax? Size measurement is as average diameter, that is AD in centimeter, is equal to A plus B plus C, that is A for apex, B for base, and C for center, and then divided by 3. If average diameter is of 1 centimeter, then it is equal to 10% of pneumothorax. And then if AD of 4 centimeter, then it shows 40% of pneumothorax. What is the extraperitoneal drainage of appendicular abscess? Under general anesthesia or spinal anesthesia, incision is made in the lower lateral aspect of swelling above the inguinal ligament. Skin external oblique muscle is cut. Peritoneum is reached, but instead of opening it as in appendectomy, finger is introduced laterally and posteriorly. Abscess cavity is opened and pus is drained extraperitoneally and is sent for culture and sensitivity. What is biochemical frozen section? It is measurement of parathyroid hormone during surgery on parathyroid gland. 50% reduction in parathyroid hormone level as compared to baseline pre-excision parathyroid hormone level within 5 to 10 minutes of excision accurately predicts post-operative normocalcemia. What are deep abscesses with no fluctuations? These are issue-rectal abscess, carotid abscess, breast abscess, prostatic abscess, and mid-palmar abscess. What are special types of secondaries? Precautious secondary, metastasis before a primary is suspected. Example as in case of carcinoids and rectal carcinomas. Synchronous secondaries. Primary and metastasis are detected at the same time or within 6 months of treatment of primary. Example as in case of carcinoma stomach. Then metachronous. Metastasis appearing more than 6 months after treatment of primary are called as metachronous. For example, melanoma of choroids. Why? When we open pseudocyst of pancreas in stomach, as in gastrocystostomy, stomach contents do not go into the cyst cavity. When done, cyst collapses providing no space for gastric contents to move back in the cyst, and also because of mucosal folds of stomach, contents do not go inside the cavity. What is toothpaste appearance? A recurrent laryngeal nerve is identified by this appearance, and it is given by a small vessel running over nerve giving a reddish tinge. Why no breast conservative surgery in collagen vascular disease? Example in patients of rheumatoid arthritis, scleroderma, and SLE. There is increased incidence of radiation therapy related complications after breast conservative surgery. These patients are very poorly tolerant to radiotherapy. What are abdominal conditions causing legs to be placed in semi-flexed position? These are obturator hernia, pelvic appendix, and psoas abscess. What are causes of non-healing of enterocutaneous fistulas? Remember mnemonic friends: F for foreign body, R for radiation, I for inflammatory bowel disease, E for epithelialization, N for neoplasia, D for distal obstruction, and S for sepsis. Why gallbladder carcinoma is worse? Biologically, it is very aggressive, higher incidence of lymphatic spread, easy spread to liver, intraductal spread to CBD causes obstructive jaundice, infiltration into gut and stomach, and radiation and chemotherapy are less effective. What are signs of normal T-tube cholangiogram? No negative shadow, no cutoff sign, dye into duodenum, no spillage, no dilatation of intrahepatic ducts, and lower end of CBD is tapered. What is difference between operability and resectability? Operability represents pre-operative evaluation of operative field. Resectability represents operative evaluation of operative region. What are differences between perianal fistulas caused by tuberculosis or inflammatory diseases? Tuberculosis opening does not have indurated area, and on squeezing there is watery discharge coming out through it, while in case of inflammatory fistula these have indurated areas and discharge pus on squeezing. What are joints in surgery? Size of giant duodenal ulcer is more than 2 cm. Size of giant gastric ulcer is more than 3 cm. Size of giant fibroadenoma is more than 5 cm. And diameter of transverse colon in toxic megacolon is more than 6 cm. And size of giant nevus is more than 20 cm. At last, I am very thankful to you for your kind attention. I hope you have enjoyed today's lecture, and stay in touch, stay blessed, take care, never miss any video, and subscribe to my channel